Beginning in 2015, Medicare established CCM, chronic care management, to reduce costs while improving patient outcomes. In December 2021, financial incentives were put in place by the Centers for Medicare and Medicaid Services, CMS, to sharpen the focus on proactive care for patients with chronic conditions. One focus area, chronic care management, is particularly promising. By increasing CCM reimbursement by 50% on January 1, 2022, CMS is driving change across the entire healthcare landscape. With CCM in place, healthcare systems and medical practices, including specialists, can see gains arise in quality, cost, satisfaction of patients and providers, and of course, financial sustainability. CCM done right has been shown to increase engagements with patients by tenfold, identify and close 6+ care gaps per patient per year, cut emergency visits significantly, up to 5%, drive patient satisfaction to nearly 100%, and deliver approximately $320,000 in reimbursement per 500 patients enrolled. The question is no longer if CCM should happen, but rather how to make it work at scale. This guide provides the steps to implement CCM quickly and efficiently. Learn how to jumpstart your CCM program immediately. From 250 to 500 patients enrolled within the first 60 days using our resources, making it free to you. Medical practices need this. What is chronic care management? So chronic care management is within reach for all healthcare systems and medical practices. Even though healthcare systems and medical practices are facing many challenges, this is within reach. Among them are declining reimbursements and record levels of burnout. New technology promises some relief. Choosing the right path can be a big undertaking, with quality of care, patient outcomes, and the success of the practice potentially impacted. We offer a proven solution, implementing a CCM program at scale according to best practices, supported by technology. Here we explain how to build a streamlined CCM program to better support patient care. We do the work to reduce provider burnout to create financial sustainability for your practice. Chronic Care Management, CCM, is a program from the Centers for Medicare and Medicaid Services that offers monthly reimbursement to care providers for the support regularly provided to patients between visits. Chronic Care Management is within reach for all healthcare systems and medical practices. The introduction of patient support codes will increase your Medicare billing substantially, but can be outsourced and somewhat automated to keep your implementation costs low. CCM allows billing for previously unreimbursed everyday activities done by clinical staff, such as phone calls and patient questions, medication refills and adjustments, scheduling, referrals, and prior authorizations, care planning, and care coordination. Most organizations lose money on CCM because they implement a labor-intensive approach using EHRs, electronic health records, monthly phone calls, and manual documentation. CCM lends itself to technology solutions. With an effective supporting technology partner, CCM improves quality of care while reducing busy work and automatically makes staff time billable. It is the easiest way to grow revenue without increasing the number of patients you serve, while reducing demands on you and your staff. It is possible to thrive and improve patient outcomes. The new era of CCM. In the new era of CCM, providers will have less busy work and will have more time to focus on providing better care for all their patients. Patients will receive proactive care management between office visits, and reimbursement is available for all the work done, not just billing for office visits. Chronic care management time can be billed every month, creating a new recurring revenue stream. This can result in doubling the annual revenue of the practice. According to data from existing CCM programs, if done right, can generate up to $26,000 in net monthly profit, while improving the quality of care for as many as 500 patients. However, the national median number of CCM patients is currently 44 patients per staff member, with only 3.34 claims submitted per patient per year. For many practices, 40 to 50% of their patients are CCM eligible. CCM is not profitable or even reachable without supporting technology solutions. CCM makes sense for everyone. CCM not only makes financial sense for healthcare systems, primary care, and specialty practices, it reduces the burden of in-person visits for clinicians, staff, patients, and their family members. It is possible to enable a care team to easily manage thousands of CCM patients by replacing long phone calls with AI-powered text follow-ups and by auto-documenting every interaction to ensure patient compliance. Coupled with licensed support staff, RNs, LPNs, and CMAs, outsourcing makes sense. Technology alone is not the solution, but supports your efforts in a way that increases patient satisfaction. We uniquely offer a combination of technology and real care that matters. This is an additional $64 to $160 plus per patient per month based on time and complexity. A provider can thereby earn $320,000 per year for every 500 CCM patients enrolled. This is a great incentive to offer a higher standard of care for patients with at least 2 chronic conditions. According to McKinsey, a strategy focused on chronic disease could transform a health system's strategic and operational priorities. Given the value at stake and the strategy's ability to improve patient care and reduce costs, we believe a significant advantage exists for healthcare systems that take the lead in this redesign of service lines. Why CCM now? Health systems and medical groups adopting CCM today have a powerful ally. Medicare has doubled down on CCM. CMS has made this a top strategic priority for 2022, including offering greater incentives to physicians who provide CCM services to patients and increasing reimbursements by 50% in 2022. At the same time, reimbursement for office visits went down, making CCM more profitable than office visits. With such incentives in place, it is time to secure this income. Although many healthcare systems and medical practices have begun offering CCM programs, most are doing so at small, unprofitable scale, using legacy technologies including a pre-existing EHR and telephone calls. Scaling a CCM program can seem overwhelming, taxing an already overworked organization for a small percentage of patients. For HCPs that enroll between 40 to 50% of Medicare patients, an achievable first-year benchmark, CCM becomes a game-changing core service line, like office visits. This step-by-step approach, This step-by-step guide is written explicitly for healthcare systems and medical practices, including specialists looking for a sustainable way to build a healthy and profitable organization. It rests on a foundation of best practices and trusted technology, with CCM at scale as a service line, not as a side project. Here we talk about how this guide explains how healthcare systems and medical practices that follow this path can flourish even in the post-COVID healthcare environment. Using this guide, you can determine if CCM will work for your practice, what you stand to gain from it, and the exact steps to take to get started right away. More patient visits is not the solution. More work for less pay is a daily reality for many healthcare providers. Every healthcare provider has felt the pressure to see a high volume of patients. Patient visits are reimbursed, so scheduling more visits seems to be a logical step to increasing profits. While some providers do see a direct increase in income based on patient volume, many who don't feel the pressure regardless. Tight schedules leave little room for documentation in EHRs, often leaving providers with hours of data entry to do at the end of a long workday. This can change. In fact, providers report that this is the top reason why they burn out, according to a 2021 Medscape survey. Surveys on burnout indicate a crisis is at hand, with few direct solutions.